Thank you for the opportunity to present our paper on perceived stress and interest in non-invasive aesthetic procedures during the COVID-19 pandemic. I would like to thank my co-authors Mr. Gunther Scherz and Prof. Helen Smith for working with me on this important paper. Multiple effects of the COVID-19 pandemic have been described, including an increase in concerns about one's facial appearance resulting in greater interest for cosmetic procedures. However, additional research is required to examine the impact of the pandemic on patients' overall stress levels and whether this reported stress is associated with an interest in facial aesthetic procedures. We aim to describe perceived stress levels and to identify factors associated with increased stress among patients seeking facial aesthetic treatments during the pandemic. In addition, we sought to evaluate whether stress levels influence the likelihood of proceeding with aesthetic treatments. Patients coming to a Singapore-based clinic and who completed a self-administered questionnaire over a 1-month period were included. Stress was evaluated using the Perceived Stress Scale, PSS. Additional questions sought to understand factors associated with perceived stress, prior treatments, and future interest in aesthetic procedures. 213 respondents participated in the study. Separation from family and inability to travel for leisure were major stressors in 54% and 55%, whereas getting COVID-19 was less frequently a stressor. Patients reported greater concern with appearance, and 91% of patients continued aesthetic procedures despite the pandemic. 75% reported interest in proceeding with treatments not previously tried before. PSS scores were higher than published norms. Factors associated with increased scores included residency status, job insecurity, and markers of increased concern about appearance. Significantly higher stress scores were seen in patients seeking aesthetic treatments. We identified factors associated with increased stress and most identified an association between increased likelihood of proceeding with any aesthetic procedure and higher levels of stress. This highlights the importance of caution in treating patients at this time, given their increased stress levels and potential vulnerability. For any queries relating to this study, please use the following contact.